Hi, welcome back to Antai Hospitals YouTube channel, and let's continue the discussion of adenomyosis treatment with a follow-up question that we have been getting since yesterday's video, which is since our ultra-minimally invasive technique seems to be so effective compared to conventional treatments, is there any restriction on when you receive this treatment? So let me summarize this question in a simple way, which means, when should I receive this treatment on my menstrual cycle? Should I receive it before my period or after my period? Does it affect the procedure? Will I need to be concerned? So this is a very good question and very common indeed, and it answers certain concerns of these patients, because when you go for conventional treatment, especially those that tend to remove your uterus or remove parts of the uterus, they will need you to be conducting this surgery outside of your menses. So you need to plan properly and also time it with your cycle. As for our ultra-minimally invasive technique, which is our injection of these specific medication, we call them as apoptotic agents, which means they can kill these displaced tissues. It can simply cause this displaced endometrial tissue that is growing in the myometrium now, which is exactly what adenomyosis is. It can go into apoptosis, and then the swelling can reduce, and then you are effectively recovered from this condition. So our technique does not require any time frame, any window that you need to seek it. You can come at any time, and of course, to answer this question again, we want you to receive as soon as possible, because the more you delay, the more periods you will get, the more severe the pains will get. And for adenomyosis, it is already associated with being one of the most severe menses pains one can experience. Regardless of any type of condition, adenomyosis caused or induced menstrual pain is incomparable. So not only can you receive it anytime during your cycle, even outside of your cycle, or even during your period, you can still safely receive this treatment. It does not affect anything. It will not cause any complications. And you need to keep in mind that you want to receive it as soon as possible, as soon as you're diagnosed. You don't want to delay, because pains will get severe. And if you delay for years, it may affect your fertility, because not only does it affect your cycle, it affects your ability to get pregnant and your ability to sustain pregnancies, which is why it's a common cause for recurrent miscarriage. So again, our treatment simply does not involve surgery of the uterus. We don't incise or do any surgical cuts on the uterus. We simply inject this apoptotic agent on each of these lesions. So many doctors will consider these adenomyomas to be the exact same as the endometrial tissue. They're simply displaced. However, this displaced tissue, fundamentally speaking, they are not the same thing as the endometrial tissues. Although they behave similarly and they also are observed to be very similar, fundamentally they are not of the same cell types, same tissues. That's why our apoptotic agent is only specific to this adenomyoma. It's engineered specifically, formulated specifically to just kill these adenomyomas, which are displaced tissues. So it will not affect your endometrial health as well, if you are concerned of that. So some patients will think that if you do inject it to the adenomyomas, it will affect endometrial health as well, but rest assured that is not the case, because fundamentally these two tissues are completely different. Furthermore, the benefits, it does not involve any cuts or surgeries of the uterus, and we don't even remove your organ, which is unheard of for many patients, unheard of for many medical institutions, big hospitals. They still recommend removal of the uterus as an effective treatment, but we've already covered this topic time and time again. It is a very unnecessary and aggressive treatment that leads to potential lifelong side effects, and it robs the ability for you to get pregnant, have your own children. So why would you consider something like that when there is an alternative treatment which is by far the most effective approach, and it is minimally invasive, does not involve any uterine surgical procedures, and you can still keep your organ and achieve healthy pregnancy? Now, there are so many benefits to this, and one last benefit that I'd like to add is that Antai Hospital, we offer this treatment with a full refund money back guarantee, contractual basis. If you do not seem to enjoy any of the benefits that I've mentioned just now, if you do not seem to recover from your adenomyosis even after receiving treatment with us, then we offer you full refund guarantee. That's how effective this treatment is. And rest assured, if you are concerned about removing these abdominal pains, which we fully understand, many of these women are considering these drastic measures because of how debilitating the pains are. Rest assured, hysterectomy is not your final solution, and you can get to keep your organ and get to preserve your fertility as well, which is another important goal that people tend to easily give up. So please get in touch with Antai Hospital for this new ultra minimally invasive procedure for the treatment of your adenomyosis. If you are serious about keeping your uterus, preserving fertility, please get in touch with us. Remember, you do not have any time restriction. The sooner you get diagnosed, the sooner you should come for treatment. Please stay tuned to the next video and leave me some feedback down below as well.